So one of the important things to know is these antigens that you see on the RBC surface, they are glycosphingolipids. Glycosphingolipids. Okay, but these antigens of the ABO system, they're not just present on RBCs. They can also be secreted from the GIT. Actually, 80% of the population will secrete A and B antigens, these antigens, in the gastrointestinal system, in their secretion, in their saliva, and all those other places over there. So those people are called secretors, whereas 20% are non-secretors. So 80% are secretors. Okay, and when they secrete it in the GIT, it is not exactly a glycosphingolipid. It is what do we say? It is more like what do we say? It is an oligosaccharide plus protein. You wouldn't exactly call it a glycosphingolipid. They are glycoproteins. Glycoproteins in this case, when they are secreted in the gastrointestinal system and other such places. The chromosome for the ABO blood group system on which all of this is chromosome number 9. So remember, chromosome number 9 does this. All these ABO systems, what we were discussing about over here, the chromosomes over here are chromosome number 9. Chromosome number 9. And what happens is, so when you have an A blood group, there is an enzyme that's going to transfer your your different carbohydrate moieties like N-acetylgalactosamine, okay, to make it an A antigen. So that's called A transferase. And when it comes to the B blood group, if you have that allele, then it will transfer the galactose, and this is called B transferase enzyme, which is present here, or transferase B. Transferase A and transferase B, which are coded on chromosome number 9. Now, other than that, you should know that you may have the alleles of A and B at birth, but it doesn't mean you're going to express these antigens immediately at birth. Sometimes some people take up to 3 to 6 months to express these antigens on them. So 3 to 6 months of life to elicit antigens. Now this happens after the baby starts eating food, other than the breast milk, food like fruits, vegetables, and meat, which have these antigens in the food, and then they start to express it on their cells that time, especially in the microbes and especially the plant foods. If you see, they have antigens similar to the AAB system, and that is what is going to activate the expression of these antigens in our body. All right, so that is how these things are expressed eventually. Then other than that, if we look at Rh antigens, they are only found on the RBCs. They do not go in any other part of the body. They are very much integral to the RBC surface.